Hey everybody, Dr. Rob here. I'm addressing my new norm. I'm out on my patio again. A lot of people had said they really liked seeing me out on a patio. They like me in a more relaxed setting and mood. So here I am. Wanted to talk to you today about comorbidities of health. With this health pandemic just growing every day, people want to know what is a comorbidity and what are the actual conditions that lead to poor health. And as I put in the post, 60% of Americans, and this is quite important, 60% of Americans have one comorbidity towards bad health. And there are actually more that I could have listed. Those are actually listed in reference to the virus issues. So number one, I hope everybody's doing all right. I'm here. If anybody needs me, once again, you know how to get me. Say hi, reach out. Feel free to ask questions. I'm always getting a ton of questions after the fact because we're only on for about 15 minutes. I answer all my questions. We're doing a lot of telemedicine. So those who, my patients know that we're doing telemedicine for chiropractic. We're doing telemedicine for nutrition. Anything you need, you can get in touch. Any immune boosting, any gut boosting, any health boosting, we have that available for you. Feel free to ask, and everybody knows how to get in touch with me. So I wanted to go through some of the comorbidities in reference to COVID-19. So they did a study that came out of China, and they studied, I have all my notes here, 1,590 patients. So a comorbidity is an existing illness. It's something that you had before. So what are we saying? We're talking about people who have some sort of chronic disease or predisposition towards a disease. So those people, they talk straight fatalities. Horrible conversation, but these were the numbers. No other health condition, it was less than 1% of people who died. Those who had cardiovascular issues or cardiovascular disease, it was 10.5%. This is in China. This is a small sample size. Diabetes, or diabetics, mostly type 2 diabetics, 7.3%. Chronic respiratory diseases, 6.3%, like a COPD. And all this is going to make a lot of sense as we talk through it. Hypertension, 6%. And those who had cancer had a 5.6% of fatalities. I'm fine. It's just my allergy is bothering me a little bit. They also did a study and found out that out of the 399 patients that tested positive, one additional disease that additional disease gave them almost an 80% more increase in need for a respirator and a ventilator. Some of the other things that I would strongly recommend that you look at, we said diabetes, but there's metabolic syndrome. So there's 5 issues or 5 conditions. You need 3 of them in metabolic syndrome. Waist, so if you're a female, if your waist is over 35, that's a problem. Waist over males, 40. Blood sugar over 100. Elevated triglycerides over 130, blood pressure 130 over 85, and a decreased HDL. HDL being happy, you want it high, it's good cholesterol, under 40 for a male and under 50 for women. Women have higher HDL, good cholesterol, and the reason is they're estrogen based. So if you got 3 out of 5, you have metabolic syndrome, which is a precursor to diabetes. What was most interesting about this was, let's look at some of these. Obesity, they didn't talk about, but obesity without question, when you look at the obesity scales in America, 29 states have a obesity rate of 50% or more, and no state in the US has less than a 35% obesity rate. So with that obesity rate, that poses an issue in that people who are obese, have an issue because they're chronically inflamed. So with that inflammation, they pose a problem. So I use the word inflammation. So obviously the idea of inflammation and chronic inflammation poses a problem. When people are inflamed and then they get attacked by like a virus, they're more inflamed. So the idea is it's kind of like a glass of water inflammation. So if you're healthy with no comorbidities and you work out, there's no water in the glass. As you have inflammation, you may be heavy, you have diabetes, each one of these diseases, each one of these issues pours water into the glass, and all of a sudden the water's at the top of the glass and you get attacked and the water's spilling out and you go, oh my God, I have a mess. And that means you have this chronic inflammation, and that chronic inflammation sometimes shows in the idea of this cytokine storm. So remember, your health is like a glass. You don't want to fill it up with inflammation. You want to take it away. So interesting, again, when we get back to the comorbidities, China is a country that doesn't have an obesity problem. America is clearly a country that has an obesity problem, as I stated before. But I wanted to go and mention 60% of the U.S. adults have at least one underlying health condition. So 6 out of 10 Americans are unhealthy. So when people say we're going to ameliorate it really quick, we need to make everybody healthy. Some of the good things, I know there's always a silver lining to everything, and I'm a big proponent of that. Some of the good things now is we're all talking about health. I have never seen more people call me. I haven't seen more people on the TV, people walking in the streets, walking with their family, their dogs, their children, etc. Everybody's talking about health. So health has now come to the forefront, and that's great. So if you're a person who's concerned, and because you have a comorbidity, let's talk about some things you can do to help get over that while you're home, while you're in a stay-at-home, or while you're working in a very more quiet atmosphere. Number one, we all want to keep our weight and our body fat down. Great ways to do that. Once again, I give you 3 easy ways. Let's start eating at home. Obviously, you're not going to be able to eat in a restaurant, take out, take away, whatever you want to call it. Let's eat at home. Let's eat whole foods, fruits and vegetables. Let's avoid inflammatory foods like gluten, dairy, sugar. No grains. Somebody had asked me about grains. Grains are not gluten. There's an argument that some people say they are because of the soil, but essentially grains are not gluten, but grains are inflammatory. So let's avoid the rices if we can at this point. You can have something called ancient grains. Quinoa is a great choice. Sorghum, things of that nature. Once again, the fruits and vegetables. Eat a more plant-based natural diet with good quality proteins. Good quality proteins are going to be, of course, chicken and turkey if you're philosophically allowed to do that. Fish, which we talked about before. I use the acronym wild fish, smash, salmon, mackerel, anchovies, sardines, and herring. What a great choice. Grass-fed beefs. I mean, we just had some bison. You want to have a pizza. You obviously don't go to a pizzeria, Frankie and Johnny's, or whatever you may call it. You can have a pizza like at my house. We had cauliflower a crust. Delicious. What did we have on it? We had organic vegetables. We had a vegan cheese, a vegan non-dairy cheese. We had some other assortments, herbs and spices. And on top of it, we had some good free-range eggs. So the pizza was great. I actually had that for breakfast this morning. So there are ways to get around it. Use a cooker, a rice cooker. Use a steamer. George Foreman grill. I own no stock in any of these things. Prepare your foods. I have a funny feeling that when this is all said and done, Bobby Flay is now going to compete against the new chefs. And those chefs are the people in home cooking now. It's going to be recipe books. There's going to be a plethora of recipe books. The other thing I like is exercise. You have that opportunity. Yesterday, I took you down to my home gym. You only need this much space to exercise. Go outside. If you probably look in the back, you'll see a whole bunch of people there walking. You can hear a kid, a child with his dad playing in the background. I have enough space right here. If I went out here, I could do push-ups. I could do air squats. I could do burpees. I could do jumping jacks. I could do planks. I could do walking lunges. So there's a litany list of things. If you need some things to do, ask me. If you need some things to do, we can send you some exercises. You want to get your weight down. Blood sugar. Obviously, keep your carbohydrates low. Try not to eat too many carbs. So what's a carbohydrate? Again, a carbohydrate's usually in a package. Fruits are carbs, but they're pretty good carbs. Don't eat 10 of them. Eat 1 or 2, you'll be fine. What are good fruits to eat? Really simple. Berries, apples. Avoid the high sugary fruits like grapes, bananas, mangoes. Those aren't, even though they're really sweet, they taste good, they're not really good choices. Carbs, again, the rice, the breads, the grains. I mean, the American sandwich. Try to avoid that. I had a patient a month ago, they just called me. All they did was take gluten and dairy out, and they lost 15 pounds. Now, they were not 300 pounds to lose 1,500. They had 25 pounds to go to get optimum weight. Just taking gluten and dairy off, and didn't even put in gluten-free bread. That was a ticket. So again, those are foods to eat: food, exercise. And the third one, believe it or not, I love my intermittent fasting, time restricted eating. So a lot of literature has shown that it will enable you to have good cell health. Others have shown that it improves immune function. Who doesn't want an immune boosting moment now? With that being said, we usually talk about it in numbers. So 14 and 10 is one of my more favorite numbers. The first number, 14, is the amount of time in which you fast. 10 is the amount of time in which you eat. You have a 10-hour framework, 8 in the morning to 6 at night, likely to be done by 6 o'clock at night, is a perfect time frame. So those three things: eat good food, exercise, and do some intermittent fasting, time restricted eating, a great choice. So when we look at these particular comorbidities, you can see that if you did many of the things I mentioned, your chances of this comorbidity of obesity, diabetes, hypertension, and possibly even CVD would be precipitously decreased. Did you have somebody that had a reach out or a shout out yet? So today everybody's quiet. I guess they're, annoyed that I'm able to get some rays and some sun. I love my love and thumbs up. Can we get a shout out? Who's watching? I can't see the camera. I don't have my laptop over here. I'm totally in the sunlight, if you will. So say some names.
Adamari.
Hi, Adamari.
Siri.
Hello, Siri-wan. How are you?
Christopher Anderson.
Hey, Chris Anderson. What's going on?
Ellen.
Hey, Ellen. Hey, you got it. You pressed the button. You watched. How you doing? How's everybody? Tell Mike I'm going to give him a call, and we're going to talk about what we need to talk about. Who else do we have? Everybody's a little shy. Oh, she's having trouble seeing the names because it's in the sun. So in any case, feel free to ask some questions. Give me some comments. Tomorrow we're going to take it to another level, and we're going to talk about detoxification at this time, because I think detox is an interesting thing that hasn't been covered by a lot of the health practitioners who have these natural approaches. So keeping it simple. If anybody needs where I got that information from, that was actually in Stat Plus. It was March 3rd it came out. Believe it or not, it came out a couple of weeks ago, and I just found the article. And a couple more things I wanted to share with you. I had a couple other interesting factoids, if you will. So the age in which people in that China study got infected with COVID-19. China, 87% of the cases were people between the age of 30 and 79. 8.1% in their 20s, 1.2% in their teens, 0.9%, 9 or younger, and 78% 30 to 60. Obviously, some key factors that came out. The older you are, the more chance you had of getting it, a weakened immune system. And that's actually something that I'd like to come into. Sorry for moving around a little bit, moving around the track. But why is the immune system in older people more not as potent, let's say? Well, it's an interesting thing. Let me explain your immune system to you. So you have an immune system, and it has two buttons. You have an innate immune system, and you have an adaptive immune system. Your immune system, your innate immune system, is what God gave us from day one. Our adaptive immune system was created by human essentially 10,000 years ago. Now, our immune system has a lot of different what we call immunoglobulins. Our adaptive immune system is B and T cells. Essentially, our innate immune system is the first line of defense. It's the first line of defense against something that attacks us like a virus, bacteria, and the such. Our adaptive immune system adapts and then brings extra soldiers, if you will, with these B and T cells. Now, what's most interesting, it's the failure in our adaptive immune system, or the overload in our innate immune system, that usually compromises our immune system and lets a virus or a bacteria take over and makes us sick. We found out that as we age, we don't produce as much immune function, and our immune function isn't quite as potent. So I kind of look at like the young soldiers in a young person's body come really fast and are full of vim and vigor, when in a little older person, a chronologically older, but truly a biologically older person, they don't move quite as quick. They don't get there, and they're not as potent. And that's why we have immunocompromised older people. One of the other comorbidities that they didn't say in this, which I wanted to get out in this, was anybody who has any autoimmune, because that shows that you have an adaptive immune system dysfunction. Most autoimmunity comes from a failure in our adaptive immune system. So just because you're 50, 60, 70, or 80 doesn't mean you have to have a compromised immune function. It just means you have to work a little harder, and you got to stay on it and eat your diet. Take your immune support supplements that we all talked about. There's nothing wrong with me saying that. So you have your different mushrooms, you have your vitamin D. Yes, elderberry's fine. And if anybody wants to ask about elderberry, give me a call. It's not an issue. L-glutathione, your probiotics. And let's not forget, you got to take care of your gut. Goodness gracious, 80% of our immune cells are in our gut. And I don't hear enough people on the TV who are saying, well, let's take this herb that we've never heard before. And they forget all about their gut. Studies show that the well, we know viruses live in your gut, but this individual virus, COVID-19, lives in your gut. It actually was present in the gut with people who already had the virus and had a negative test so they could leave. So it was still there. So our gut, we'll try. I know Deborah Smith always asks me about this. Can I talk about the gut to the lung? But you know, our gut health is critical. 80% of our immune cells are in our gut. But we have a gut to lung axis, which is very fascinating. And I think we can do that in some of the Succeeding Facebook Lives. I think we had a few more shout outs.
Lauren,
Hey, Lauren.
Norman, Krista.
Hey, how are you, everybody? Can you see everybody, or is it a little hard in the snow? We're really sorry. It's kind of sunny out here, so we can't read everybody's name. So I'm going to give you a thumbs up. Do we have any questions, or is it a little hard? Okay, not a problem. So just remember, we covered an awful lot today. Oh,
Jean is 71. She jogs, runs outside for 2 miles, and have Crohn's treated with NTBO. Can I continue?
so somebody 71 years old, I think it was Jean you said, and she runs outside, and she has autoimmune, I think you said, Crohn's, right? So first of all, you know, why don't you DM me? I'm happy to share a Crohn's protocol with you. You know, a natural approach. We can talk a little bit about diet and some supplements. I'm very happy that you're active. I think you should continue to be active. My understanding is as long as we keep our physical distance, not our social distance, we've talked about that before, I think you should be okay. I'm a big believer in exercise. I mean, we were made to move. But again, feel free to DM me, and I'd like to go over that with you. We're good? Well, it's been my pleasure as always. You know, at this time when the world is changing and there will be a new normal, as they say, and I hope that everybody's doing okay, and I hope that their new normal includes health. This is not just a thing, passing fancy. Everybody now is more serious about their health. I'm here to help you. Once again, we're doing a lot of telemedicine, telemarketing. So hope everybody has a great day. I'm Dr. Rob Silverman, always yours in health.